My patient today is a 45-year-old female professional golfer. She came in complaining of a gradual onset pain that developed over the base of her right thumb and her lateral wrist. She said it's a dull ache most of the time, but with use it progresses to a sharper pain of about 7 out of 10. What makes it worse is any use of the wrist or the hand, especially the thumb. And what makes it better is rest, ice, and sometimes Advil helps a little bit too. Other signs and symptoms that she described were difficulty gripping objects and just some general weakness in the hand. And she does complain of a snapping sensation over the base of her thumb with movement. She has no previous health concerns or injuries, and she's on no medications and doesn't have any allergies. I observed all views of both hands and wrists, and the only thing I noticed was some swelling over the base of her right thumb and along the lateral side of her wrist. She has no formations or abnormalities such as Bishop's deformity, ganglion cyst, or mallet finger. For palpations, I'm going to start by taking her radial pulse. And it feels nice and strong, it feels normal. Now I'm going to palpate her carpal tunnel. There was no pain there. And now I'm going to do her metacarpals 2 to 5. There was no pain there. Now her first metacarpal. That was a bit painful, as well as I'm going to do her styloid process on her radius. And there was some pain with that as well. For functional testing, we're going to start with some range of motion. Get you put your hands out. Flex, extend, radial deviate, ulnar deviate, pronate, and supinate. Now I'm going to do that passively. Good, and then resisted. Good. Now for the fingers, we're going to do flexion extension. So make a fist and open wide, fist, open wide, and then adduction and abduction. And then do finger to thumb on each hand. Good, and she felt the most pain with thumb abduction and extension on her right hand. For the last part of functional testing, we're going to do some special tests. The first one is Tinel's sign, which is for carpal tunnel syndrome. There was no nerve symptoms produced, so it was negative. And the second one is Finkelstein's test, which tests for de Quervain tenosynovitis, where she's going to squeeze her thumb and then ulnar deviate. And she does experience quite a bit of pain in this region, so it would be positive.